You know, every single time you take a medicine, whether it's a pill or a patch, it has to go on this incredible journey just to get into your system. And today, we're going to follow that very first, absolutely crucial step, the science of drug absorption.
So let's just start with something we can all relate to. You swallow a pill for a headache. What is actually happening in that gap between you taking it and, finally feeling better? It's definitely not magic. It's a very carefully planned trip that starts with one clear mission.
And here's that mission defined: drug absorption. All it means is getting the drug from where you put it, your mouth, on your skin, wherever, into the body's main superhighway, the bloodstream. Because once it's in the blood, hey, it can go anywhere it needs to. But it's got to get in first.
Now, this journey doesn't just start randomly. The very first decision is choosing the right starting gate. In pharmacology, they call this the route of administration. And believe me, this one choice changes everything that comes after it. So, what are our main options?
Okay, first up we have what are called the enteral routes. That's just a fancy way of saying anything that involves the gastrointestinal or GI tract. The one we all know, of course, is oral, swallowing pills or syrups. But this group also includes sublingual, where a pill dissolves under your tongue, and even rectal administration. They all use the gut as their front door.
Then you've got the parenteral routes. Basically, we're talking about injections. This path is like a direct shortcut. It completely bypasses the whole digestive system. Intravenous, or an IV, goes straight into a vein. Intramuscular goes deep into a muscle, and subcutaneous is just beneath the skin. Think of these as the express lanes for when a drug needs to work super fast or just wouldn't survive the harsh environment of your stomach.
And of course, there's some other really specialized routes for specific missions. You got the transdermal patch that delivers medicine slowly through the skin, or a nasal spray, or an inhaler that targets your respiratory system directly. Each route is a unique starting line, totally tailored to the drug and its job.
Okay, so the drug has its starting point, but no matter which route it takes, it immediately runs into its first huge obstacle, the body's own border security. See, to get into the bloodstream, a drug has to get through layers of cells, and that means it has to find a way past the cell membrane.
So how in the world do drugs sneak across this border? Well, they've basically got three main strategies. There's passive diffusion, which is kind of like the drug just slipping through the cracks. Then there's filtration, where it squeezes through tiny pores. And then you have the most complex method, carrier-mediated transport, which is like having a special escort service to get you across.
Let's take a closer look at that escort service, because it comes in two different types. You've got facilitated diffusion, which is like a free taxi. A special protein helps the drug get across, but it can only go downhill with the flow. Active transport, though, that's more like a powered shuttle. It also uses a carrier protein, but it burns energy to literally push the drug uphill against the natural flow.
All right, so our drug has a route and a way to cross cell membranes. Awesome. But the journey is far from over. The body is a seriously complex place, and it is full of roadblocks and toll booths that can mess with the whole mission.
And this brings us to a really interesting challenge: the body's own internal chemistry. You have to remember, as a drug moves from one part of the body to another, let's say from the superacidic stomach to the much more neutral bloodstream, that changing environment, especially the pH level, can create these chemical traps that just stop a drug cold.
This bizarre little phenomenon is called ion trapping. Here's the deal. A lot of drugs can exist in two forms, either charged or uncharged. Only the uncharged form can easily slip across cell membranes. So if a drug moves into a new area with a different pH, its charge can suddenly flip, and now it's trapped. It literally can't cross back the way it came. It's like a one-way chemical door slammed shut behind it.
Aspirin is the classic example of this. In your stomach, which is super acidic, aspirin is mostly uncharged, so it has no problem passing into the cells of your stomach lining. But inside those cells, the pH is neutral, and that change is enough to flip the aspirin into its charged or ionized form. And just like that, it's stuck. It's trapped in the stomach lining, which, by the way, is part of what can cause that gastric irritation.
Now, for any drug you take by mouth, there is another major toll booth it has to get past: the liver. After a drug gets absorbed from the gut, all that blood flows straight to the liver, which is the body's main filtration plant. And this first-pass metabolism can actually break down a huge chunk of the drug before it even gets a chance to do its job in the rest of the body.
And oh, the list of potential roadblocks just keeps going. The way the drug is actually made, its particle size, that matters. Whether you've just eaten a big meal can totally change things. Even how fast things are moving through your gut plays a role. And some drugs, like insulin, are just completely destroyed by the gut. That's exactly why you can't take it as a pill.
So, after navigating all these different paths and surviving all of those obstacles, how do we actually measure success? How do we know how much of the drug really made it to the finish line of this first critical leg of the journey?
Well, the answer is a really important concept called bioavailability. It's basically the final score, the report card for absorption. It tells us exactly what percentage of the dose you took actually made it into the bloodstream, intact and ready to go to work. It is the ultimate measure of this whole journey's success.
And this brings us right back to the beginning, to why that route of administration is so incredibly important. I mean, this chart says it all, right? A drug given intravenously through an IV has 100% bioavailability. It has to. It's put directly into the blood. But a drug you swallow will always have a bioavailability less than 100% because it has to survive ion trapping, first-pass metabolism, and all those other hurdles we just talked about.
So here's the bottom line, the big takeaway. Absorption is not just one simple thing. The path that's chosen and the gauntlet of obstacles a drug has to survive, all of that directly determines how much of that medicine actually gets a chance to do its job in your body.
So the next time you see a doctor deciding how to give a medicine, you'll get it. You'll understand the complex journey they are planning for. So let me ask you, now that you know about this insane obstacle course, does it change how you think about the difference between just a simple pill and a critical IV drip? It's something to think about.